What is prostatitis and how does it affect the prostate? Imagine a small but mighty gland nestled below the bladder, working tirelessly to produce fluid for semen. That's the prostate gland. Sometimes, this tiny gland can become inflamed or infected, leading to a condition called prostatitis. This inflammation can cause swelling, irritation, and pain in the prostate area, which often results in urinary problems and discomfort in the pelvic region. Prostatitis affects the prostate by making it inflamed and sometimes swollen or tender. When inflamed, the prostate may press against the urethra, the tube that carries urine from the bladder out of the body. This pressure can cause symptoms like frequent urination, a sudden urge to go, pain during urination, or a weak urine stream. These symptoms can be quite bothersome and impact daily life. There are four main types of prostatitis, each affecting the prostate differently. The first is acute bacterial prostatitis, which is a sudden bacterial infection. It often causes severe symptoms like fever, chills, pain in the area between the scrotum and anus, painful urination, and sometimes feeling generally unwell. The prostate in this case is usually swollen and tender, and it requires prompt medical treatment to prevent complications. The second type is chronic bacterial prostatitis. This involves recurring or persistent bacterial infections of the prostate. Symptoms tend to be milder but can include ongoing urinary issues and pelvic pain, with occasional flare-ups of infection. It can be more difficult to treat because the bacteria may linger or recur. The third and most common type is chronic prostatitis or chronic pelvic pain syndrome. This form does not involve bacterial infection but causes long-lasting pelvic pain and urinary symptoms. The prostate may be tender but not swollen, and the exact cause is often unknown. It can significantly affect quality of life because of persistent discomfort and urinary issues. The last type is asymptomatic inflammatory prostatitis. This is when the prostate shows signs of inflammation but causes no symptoms. It's often discovered accidentally during examinations for other prostate conditions, like screening for prostate cancer. Prostatitis can influence overall prostate health and sometimes complicate the evaluation of other conditions like prostate cancer. For example, inflammation can temporarily raise levels of prostate-specific antigen, a marker used in screening tests. While inflammation itself isn't cancer, ongoing inflammation is an area of active research for its potential role in prostate cancer development, though no direct cause and effect has been confirmed. Risk factors for prostatitis include urinary tract infections, prostate enlargement, pelvic injuries, use of catheters, and certain sexual practices. Men over age 50 with enlarged prostates are more prone because urinary obstruction can promote bacterial growth, leading to infection and inflammation. In summary, prostatitis is an inflammation of the prostate that can cause urinary symptoms and pelvic pain. It may result from bacterial infections or other non-bacterial causes. Its presence can influence prostate function and complicate the assessment of prostate health, including screening for prostate cancer. Proper diagnosis and treatment depend on the specific type and cause of prostatitis, so consulting a healthcare professional is essential for effective management. Remember, each person's experience is unique, and medical advice tailored to individual needs is always the best course of action.